I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
I'm a neuropsychologist from Baltimore, and I have not given or been associated primarily with ECT patients, but for 30 years I've seen the effects of other traumatic insults to the central nervous system. First of all, I want to also express my gratitude to the panel for what I think is a well-balanced presentation. But I would like to support what this lady said about reading two statements put out, one by professional organizations with which I'm associated and one by the patients. And I would say that in balance, I wholly subscribe to the patient's point of view on this particular issue. I would just like to briefly outline why I do so. The reason is that we have invented a new word, which is anterograde memory, which is sort of a contradiction in terms, really. Anterograde memory means that we are talking about recording information, putting it into a dynamic working memory, retrieving it, associating it with old information. In other words, all the things that have to do with thinking efficiently. And what these folks are saying is that a significant number of them find themselves not thinking efficiently. And Mr. Small from Indiana indicated that his scores indicate that everybody is okay. Well, my scores on neuropsychological tests also indicate that everybody is okay if I use the right hand or device the full-scale memory. But if I keep track of all the symptoms that people have, they're not okay. They tend to be a little bit more concrete. They tend to perseverate. They tend to disassociate. They tend to be a little bit more forgetful. They tend to be a little bit more flaky. They tend to do all sorts of funny things. Now, these are not funny people. They're serious people who want to go through life. And if you want to know how it affects the quality of their life, it may not affect it on an IQ score, but would you want to marry somebody who is just a little bit flaky, who is just a little bit forgetful sometimes, and so on and so forth? So my point is not that ECT is bad. We're talking about trading symptoms. My point is that neuropsychologists, in particular my profession, ought to get off its backside, not give summary scores, but instead keep track of symptoms and do some decent epidemiologic research to find out what really happens to people. Thank you.
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope you might make copies available for the panel. We're talking about having a police factor information on the device and what we're using. And one copy is the Thymatron, the brochure on a single sheet handout on the Thymatron pulse ECT device. And in there it shows the physical characteristics. I've also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding, like the truth and lending and what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1 pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol experimental head of this device for years now. Why hasn't this information been gathered that we could be talking with concrete, objective facts rather than subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gun.
Huh?
Out with your gun.
Okay, this won't hurt. It'll be over in just a moment. Uh-huh. What's that?
Conductant.
Oh, dab will do you. Right, Mr. Jackson.
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well,
Now just bite down on it.
oh.
That's right. Just bite down.
Huh?
Now bite down on it.
Good. Are you ready? Here we go.